Yes, guys, we still have so much more to come. You have no idea what's waiting. But hey, right now we have our parenting segment, and joining us on the couch is OluwaTobiloba Jolugbo. She is a skilled realtor, communications and persuasion expert. And this morning we'll be digging into building self-confidence in children with special needs. You are welcome to the show.
Thank you.
All right, let's go right into it.
All
Now,
right.
self-confidence is a conversation that needs to be had over and over and over again, especially with children, because I mean, it's the perfect time and period of their lives that, these conversations need to be had with them. So let's talk about what self-confidence is about and how to begin as a parent to instill that confidence in your child with special needs.
Yeah, majorly I would say putting self-confidence in kids, it's very essential because it majorly works for them and it translates to the adults they would actually be in the nearest future. And if you don't instill that, it doesn't even have to be just the ones with the special needs. Every child needs to experience self-confidence directly from parents and directly from the teachers that actually instill discipline to them. So majorly, we need to start the conversation since whenever they're young. Very, very essential.
Okay. So when you say young, how old?
I think a toddler can start speaking and maybe be able to write, let's say from the ages of 3. And so instilling confidence in them starts majorly from those age, because now you have affirmative words. Schools tend to teach kids, especially the girl child, and majorly starts from the time they can blab and be able to say stuff. So it's very essential we start teaching them. It's very essential we start discussing, having that conversation with them. With the girl child, sometimes most of them think, especially in the Western world, where we have kids that are being differentiated by their colors. So some of them think that if I look black, and you have kids that will tell you, I want to look light skinned just because.
My daughter said that to me before.
Oh, you can imagine.
So she wants to have the hair as long as, Mommy, I want to have your kind of hair.
Oh, really?
Yeah.
So you can imagine that that's just some sort of way she feels, right? Now you need to let her understand the fact that there is age and there is time for all those things. Essentially, when you get to this age, you will be able to look beautiful like mom. You will be able to have this kind of hair that mom has got. So it is very important.
Now let's talk about the methods, right?
Okay.
So we're talking normal kids and we're talking kids with special
kids,
needs,
yeah.
right? What are the methods that we need to put in place in instilling that self-confidence when it comes to kids with special needs? Because I'm thinking you have to be more delicate, you have to be more, the approach should be different.
Okay, so I would majorly say spending quality time. That you're with your child is quite different from you spending quality time with that child. Spending quality time with them, and especially with kids with special needs, is they really do need confidence. I'm saying the kids that are okay, that are normal, they need to be instilled confidence. Now, talking about kids with special needs, they need more of that confidence because they already feel some sort of way already. Exactly. So you need to spend quality time with them, make them understand that in their disability, there is still an ability. And we can see that playing around in everything. You see the paramedics whenever they do their sports, and you see most of them still doing a whole lot of things that you would think it's not possible. Do you understand? So spending special time with them, making essential activities that would really, really facilitate and boost the confidence in them. And being very positive about what you say to them. You don't need the maids around you that would tell them, no, you're like this. You don't know that you can't do this. They can't do everything. They have the ability. It comes from the mind. It comes from the head. Once you give them these positive words, there's a sense of feel good that goes into their memory that makes them have the ability, oh, mom, I tried this today. Oh, dad, I did this today. They would give you that feedback and you would know that this child is really trying to be like every other kid, and never compare, because you could have a special child amongst your children. So you don't also want to, as a mom, you need to have the large heart. But we also know that some mothers are, they have their special kids, right? But when you have a child who's got a special disability, you also need to make sure the rest of the other kids understand, and we will all work on it together. Very, very essential.
Fantastic. Okay, now let's talk about the role of the school. Because I feel like, I mean, they go to school. So there's the role of the parents, and then there's also the role of the educators. How do you as a parent help the, school teachers, people around, just also in managing this child with a special need?
Okay, first of all, I'm not yet a parent. Okay, the only reason why I could talk about this topic is because I have a talk show that majorly centers about teenage age and adulthood. So I've been able to see and interview a couple of people, and to be able to determine and know why they end up where they end up, or why they think. I think that's the reason I'm able to talk about this topic. So answering your question, saying how do we treat the educators, majorly there's schools for special needs, but it now depends on the level of how special your child is. Now, if your child is exceptionally special, in that case, because you don't want to call them disabled, you don't want to use the word disabled, you'll need to make sure that you're taking them to the right school, and the teachers are so much aware of this special care and attention that they do need. So it is very important that the school is majorly centered on that, so that they have the right skilled people that can actually take care of them. Because when some teachers are not able to spend a special moment, some teachers are not patient, and every kid is not the same. So it is essential that such child goes to the school that is majorly for that. Do you understand? So when I think the people there are quite more patient. They have a larger heart to be able to handle these kids, because that's what they are trained for. You can't compare to just a teacher that just wants to come to the classroom and just wants to teach like a normal teacher that isn't really ready to babysit. You understand?
So, listening to you now, I'm in my head, I'm like, okay, at what age do you help this child to understand that you have this condition, and that is why you're different from other kids, or you're different from your siblings? Take us through the process of communicating in a way that this child understands, and at what age do you begin to tell this child that, okay, this is how you are, this is the way you are because this is what happened, talk us through that.
So I think, just like I mentioned earlier, from the time when they start blabbing, for a mom, if you notice your child has a little bit of this disability, and the child can start communicating, I think you have to go through the journey together with the child. At that point, the child would understand the fact that you take special care of he or she, aside the siblings or aside other friends. You don't allow her or him go out just the way every other friend or his playmate would go out. You understand? So when you are able to, and that would really, really foster questions. Mom, why can't I go out to play with my friends without you wanting to be there with me? I'm sorry, you can't do that because I don't want you coming. There's just a better way of having this communication. Like I said, you have to go through the journey together. And the communication is also very essential. The way you say it, the way it has to feel good. It has to be positive.
I know that this conversation is for parents, right? And it's normal to want to pay too much attention to this child with a special need, and you're not ignoring the other kids, but you're not just paying the same level of attention, which could also affect the other siblings' self-esteem or affect their self-confidence because of the attention you're giving to this other child, which could also cause rivalry.
Exactly.
So as a parent, how do you balance this?
So I made mention of the fact that you have to go through the journey with the child. You also have to go through the journey with the siblings as well, because the siblings might be the younger ones. It might be the first. And at the end of the day, you just have to make them understand your brother is like this, you know. So we all have to make sure we help him out, we assist him, and you train them that way. They just start understanding that, oh, my elder brother. It would take time before they know that maybe, let's say Down syndrome, for example, but he's already blabbing, it's already is moving, or he or she is just, you know, but you make the younger ones understand that your brother needs special care. We all have to do this exactly. You all have to make sure that we are there. The same way mommy takes care of him, it's the way you will take care of him. Exactly.
Great. This has been quite an insightful conversation. And I'm hoping, and I know that someone watching right now, a parent with a child with a special need, has learned so much from this, because it's a lot to deal with.
It is
a
whole lot.
Thank you so much,
You're
Toby, for doing this with us today.